department is all about nutrition. Okay, so I deal with whatever diagnosis the doctors have with the patients or clients, may it be diabetes, hypertension, cholesterol, since it's like an epidemic that we have here on the island. Majority of Samarnas are diabetic or both hypertension and cholesterol, and we all know that it comes from being overweight and obese as well. Many people don't know how much sugar actually is in different drinks. We never know, or we don't even read the nutrition facts that are to the back of the drinks either. And if you see 39 grams of sugar that is in a Coke, you're not really picturing how much teaspoons of sugar it is in that one drink. Whereas I have it here, about how much cubes do we have here? 2, 4, 5, 6, 7, 8, 9, 10, 11 cubes, which is 1 teaspoon each for a cube, is in one Coke. We all know Coke is sweet, so a lot of people wouldn't drink the soda. They would say, okay, let me try a vitamin water. But a vitamin water has 32 grams of sugar. And no one knows that. Everyone is very surprised of how much sugar is in a vitamin water or even a Gatorade. Now here at the hospital, when we have people coming in with ulcers, diabetic feet, I would go to them and explain them how they're supposed to eat for their particular diagnosis, whatever it may be. I would give them the information that is needed, and I would also give them a meal plan that is pertaining to what they're accustomed to. I also show them different measurements so they can have a visual of how much rice, how much sauce and vegetables that they're supposed to eat on a daily basis. And there's also where this plate comes in as well, so they can really see the division of their plate. This section here is about cholesterol. Now, as our culture has it, we love oxtail, goat meat, pork chops. That is what causes high cholesterol. It causes our bad cholesterol, which is the LDL, to go up higher, and our total cholesterol as well. To help lower your cholesterol, you would have to eat more fiber foods. Change your whole diet to whole grain, but also exercise. So instead of eating chicken wings, you change to eating leaner meats such as chicken breasts. You eat more vegetables and fruits to get the fiber into your diet. Oatmeal also helps to lower your cholesterol as well. It's all about the fiber, but it's all about exercise, and it's a whole lifestyle that you have to change. We always start mentally first, and physically you'll see it after. To keep down their sugar, to control their cholesterol, and also their blood pressure. Because little that we know how much salt is in a lot of things. So I try to teach them how to read the nutrition facts. Let me see, I have it here. Yes. This shows you precisely how to read the nutrition facts. So it shows you how much sugar is in an item, how much sodium is in an item, and that's very important when you're suffering from high blood pressure. You have to check the sodium to make sure it does not exceed a certain amount per serving. So it's very important for everyone to know how to read nutrition labels, so when they go to a supermarket, that they can take their time and read and see what they're putting in their system. We have a lot, especially diabetes and hypertension. Majority of the patients that I see, they always have diabetes and hypertension both. They suffer from both of them. Cholesterol, I don't really see that often. But the diabetes and the hypertension, yes, that is a number one for me here. Because a lot of them with diabetes come in with wounds that are not healing, and they're infected, and sometimes they even have to do amputation. It can be toes, it can be a little part of their leg, it doesn't matter. They would even clean out the wounds, but it all depends how it would heal, and if it doesn't heal properly, then they would have to amputate. So it's very important to know how to control your diabetes, because it causes a lot of complications. And besides non-healing wounds, it can cause problems with your eyes, it can cause problems with your nerves, and it can also damage your kidneys. Yeah, go to a doctor. You can go to the pharmacy The pharmacy has blood sugar testing, they have cholesterol testing. So if you don't have time to go to your doctor and to do a full lab work, you can always go to the pharmacy. They have particular days and particular pharmacies that you can go to. And also the Diabetes Foundation has days when they're on different locations where they have cholesterol and sugar testing. And there's always a nutritionist and a physician at the location for those who have increased levels, that they can have that one-on-one with them. Yes. Yes. Next to me, they're also testing the blood sugar. And next to us by the store, the Diabetes Foundation is testing cholesterol. It's a lot. It's a lot. It's a lot. Just be aware of what you're putting in your body, especially when it comes to processed foods, high sugar foods, salty foods, especially the junk food that we have on the island. It's becoming out of control. And we all need to know and learn how to read nutrition facts. We have the internet. The internet is there to inform us with as much information as we need. They can teach you how to read nutrition facts, and with that, when you go to the supermarket, you can take your time and read what's in the food that you're actually buying.
Yes, we're winding down today, and it's the last screening opportunity. And the St. Martin Medical Center has made available, instead of 3 doctors as on schedule, we have 5 doctors now doing screenings today. So this is wonderful. We have a good turnout today as well for the screening opportunity here at the St. Martin Medical Center. But it is a unique opportunity because it's not only to do breast cancer awareness screenings, but a lot of opportunity is available to see that all the different types of services that are available at the St. Martin Medical Center as well.
I must say this year has been a year above all years, if I can say so myself. I mean, the reaction, the feedback, the positive energy, and to see that all our hard work of combining activities, events, workshops, and screenings is definitely paying off today here at the St. Martin Medical Center, as we see so many ladies sitting and waiting. I guess later on you'll take a shot about that, and they're really excited, and they're here today to get checked. And you know, the whole message that the Positive Foundation together with the Electrolytes Foundation has been trying to send out for this month of October, but you know, for the whole year as well, is to get checked. And we are seeing it here this afternoon, and I can tell you their doctors definitely gonna have their hands full, literally. Well, I can say, as Shelley just stated, lots and lots of requests have been already coming in for next year. Put us on the schedule. We want to be a part of it, as I believe our month will turn into a longer extension. And as we know here today, there are different health problems here on the island of St. Martin. The balloons that are seen here today at the St. Martin Medical Center, each one of them represents a different type of illness or disease. And as Shelley just mentioned, we will hopefully be doing something for the men, because that has been a request that we've been getting over the many years. And now, for sure, we have no choice but to adhere to the call of our community.
So in other words, you're trying to tell me that men are getting jealous?
Literally, yes.
They're
because
feeling left out.
Yes, they are feeling left out, and many men have approached both of us during this whole month. Yeah, when you're gonna do something for us? You know, we need help to help us. So we are listening to the call of our males in our community, and already we started, you know, brainstorming of perhaps combining events or doing something just strictly for the guys, the men of our community. So for sure the men are gonna be pleasantly surprised.
Well, in regards to food safety, we would ask persons or the community to look at how they are preparing their food in regards to defrosting, using clean cotton boards to avoid cross-contamination. Because when we see, as CPS is responsible for surveillance, When we have a high number of gastroenteritis, diarrhea, we register that. We registered from the 5 Sentinel physician-based Sentinel sites that reports to us on a weekly basis syndromic. And one of those syndromes is gastroenteritis. So when we see a peak in that, we take that opportunity to inform the general public in regards to food safety. Check where you're eating, what you're eating, make sure it's prepared there. It's prepared in a right way, and if you are preparing at home, to avoid cross contamination, to wash your meat, to not keep it out too long. When you're cooking, do not put it in the fridge when it's too hot. Make sure it's cool, and those different type of preventive measures that you would take or look for when you're going to a restaurant. But the most appropriate entity in regards to that control, in regards to food safety, is the inspectorate, the inspectors that go out and monitor the restaurants or the food establishments, which is Mr. Trump and his team. They are the ones who really go out and give the information. But we just signal the population in regards to certain preventive action they should take and also look for in regards to minimizing the number of gastroenteritis cases.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Megawati is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
Anybody bingo? Nobody bingo.
Need a loan that's quick and easy. Island Finance. Up to 50,000 guineas really easy. Island Finance. For education, a renovation. That's no problem. Yes, it's true. That's not all. They're quick and friendly too. Island Finance. Appliances, vacations, even fix your car. You can depend on Island Finance. Here we go.
This is freedom, this is life. Happiness is all I'm seeking. Carpe diem, I'm seizing every day, not just the weekend. Here's to all the good times that have come to last. Here's to living in the now.
When you can afford what you crave, life just gets so
So
good.
alive and I'm feeling good, so good, so good, so good. Hey, I'm gonna live my life, feeling good, so good, real good, so
KFC, so good for everyone.
All this is going, I hope that this week brings us at least the beginning of a solution. However, the reason for still touching on the matter has to do with the decree, the resolution that eventually was signed by the governor and the prime minister dissolving parliament. And when you read this decree, and it's a pity that it is quoted between quotation marks in Dutch, because it is a uncohesive document, and I don't know if the government is saying what it is saying in this decree to send a message to the people, and I'll explain what I mean, or they just try to motivate something and it turns out to be what it turned out to be. But firstly, looking at the national decree, and the number that I have here is the LB 150951. However, I realized that LB, so the first LB that was signed off, has been changed just because there was a little mistake in the date of the postulation. So there is another, so that number has been replaced by another number. But remarkable in this decree, in this resolution of the government, you have where the outgoing Council of Ministers trashes its coalition partners and their independent members, Romeo Marlin and De Weaver, big time. In fact, the considerations of this national decree starts out by using that fact. So it is beyond us how members of parliament who support the outgoing Council of Ministers could accept this national resolution of October the 28th that seeks to dissolve Parliament. Because, as I said, in this very same resolution, the Council of Ministers introduces this controversial decision by starting off by what I call trashing the two independent members, De Weaver and Marlin Romeo, who defected from their parties following the 2014 election. That is the introduction, the introductory consideration of the decree, that two members following the elections of 2014 immediately defected from their party, etc., etc. And the government continues. I believe it would have served them better had it just, the government that is, stuck to its decision without trying to motivate its actions the way they did in this resolution. Because by the motivation that they have now given, and which is in the decree, it is obvious that the GUMS cabinet considers itself above Parliament and above those MPs who supported and support them. The government, by extensively seeking to come up with arguments to justify its unlawful actions, the ministers, in my opinion, are making themselves and those who put them there look ridiculous. The government claims that the independent members of Parliament create a different relationship than the outcome of the election dictates. And then the question would be, are not all 15 members of Parliament elected by the people? That is the outcome of the election. People do not vote for coalitions to say that what you have now or what you would have in the future is not representative of what and who the people voted for. So as I said before, this resolution contains many inconsistencies and it's a very uncohesive document. This is no longer about a conflict between a cabinet and a parliamentary majority. From its resolution in Dutch, the Council of Ministers is quoted as saying the following, in addition to basically throwing its coalition under the bus. The government says in the resolution, and I quote, because of the uneasy marriage, the marriage is my term, between the members of the up-led coalition, the government had to renegotiate the governing program several times. The government admits this. The government continues to say that the government, because of this, was constantly faced with the threat of its support being undermined. So apparently this has been something ongoing that we're hearing about now. And they continue to say that there's no guarantee that a future cabinet can count on the support of a majority in Parliament. But here is where it comes. The government states in this decree that the government has to take far-reaching decisions in the financial, economic area and decisions regarding integrity in government, and that those decisions, those far-reaching decisions, can only take place in a stable government climate based on a unified voters' mandate. And they continue to say that the constant changes are enough reason to hold a new election. And then the question would be, how many changes have there been since the 2014 election? Reference is made in this decree still to the 3 integrity reports and their conclusion that parliamentarians who cross the floor have negative consequences for the integrity and quality of government.
It was definitely a very good meeting, and the reason why I say it was a good meeting is that we discussed new challenges, and not only new challenges what we've been discussing for a long time already, climate change, but we're now getting a little bit more detailed about the health implications. And the health implications, let's take for instance, when you have a very long time of dry periods in the country, we just had to look around. The hills were dry, and the persons that had complaints were persons that suffer from dry weather, hot weather, heat. So elderly persons, they get dehydrated very fast. So you have to be very keen on making sure that when it is a dry period, people take a specific measure to make sure that the elderly are being hydrated, or other persons, the disabled persons who cannot take care of themselves. Small thing, but an important thing. We also heard the complaints of the persons who practice agriculture. And when agriculture is at stake, that means that the production of fruits and vegetables is at stake. So we talk about St. Martin, but it's a global thing we're discussing. So if the food production is going to reduce because too much drought is around, then this is something we have to start thinking about. Will we be able to stop it? No, because El Nino has been there for years. But will we be able to do something about climate change? Yes, maybe in St. Martin we can do a few things, like choosing for more environmental friendly ways of using energy. Moving into wind energy, solar energy, those kind of things might be a discussion. At the same time, when you look at too much water, when it rains too much, then water kicks in, stagnant water, mosquitoes, dengue, chikungunya, Zika. But then, of course, also injuries, other problems can occur, with mudslides coming down, too much dirt in the road. So those are all things, although you might not think about it as a health issue, at the end of the line, if something happens, the health sector has to take care of the results of those impacts. So yeah, that's why it was very interesting, and those will be things that in our discussions on disaster preparedness, we will have to look into that, and in the disaster preparedness of the region, that is also going to be included. And a target group that was discussed that also play a major role when it comes to disaster is the media, because usually they say risk is hazard plus the perceived outrage, and outrage you can safely say it's fear. If people perceive a risk as being high, but the hazard is not high, it is because people think that it is serious. And having the opportunity to work with the media so that they can minimize the outrage, minimize the fear, give correct information, just what you're doing here now. Sit in with us, discuss this with us, so that the general public can hear about it, know what we do.
It's been said that behind every door, possibility awaits. How much possibility depends on which door you open first. Every day, we help our customers discover the possibilities in their lives. It all starts with a conversation. Scotiabank.
Anybody bingo, nobody bingo.
The fire department's task is to prevent loss of life, prevent injuries and prevent loss of property. We could do that by responding after the facts, after an accident happened, but we also believe we could prevent even more if we can educate the people and help them to help themselves preventing injuries and loss of property. And one of the ways is by installing smoke detectors. If you have a smoke detector, as soon as you have smoke in the house, the smoke detector will detect it, let you know, and hopefully this fire is small enough that you could out it by yourself. If not, you get out immediately, you call the fire department, but at least you're out on time. So we prevented injuries and we prevented death, and that's why we are busy now with the campaign Smoke Detectors Save Lives. For the month of October, we have been going out to the different homes. Month of November, we will continue with it also, and we're actually looking to continue this project not just for these coming months, but we want to have it as an ongoing project. As long as we have sponsors, we will keep going and to the different houses installing smoke detectors.